Good morning, everyone. We'll get started here. Thank you for joining us this morning for a conversation about how substance misuse impacts your workplace, titled The Highs and Lows. This is the fifth of 6 HealthLinks webinars over the course of this year, and we've just been so pleased by the amount of participation and all of you joining us today. A few housekeeping items before I introduce myself. I'm David Shapiro, and I'll introduce myself again in just a moment. Everyone is on mute throughout the duration of today's presentation, and if you have any technical issues, please use the chat function. And if you want to test that and see how it's going, we'd love to hear where you're joining us from. We know people are joining us from all over the country and internationally, and so if you want to pop into the chat and tell us where you're joining us from this morning or afternoon or wherever time it may be where you are, we'd appreciate it. We're going to move all of questions for our keynote presenter and our panelists over to the Q&A box. So if you do happen to put a question for us as speakers into the chat function, our team will go in there and ask you to move it directly over to the Q&A box. The reason we do that is because other people may have the same question as you, and you can use the thumbs up button to move things up on the agenda, and if you don't want to have to type something the same as everyone else. So use chat to tell us where you're from this morning, and Q&A for any questions you may have. We are doing a recording of this webinar, and you'll get access to that in our follow-up email. Closed captioning is available through Zoom instructions, and there is a survey at the end of today's session. You need to complete that survey if you want to get your continuing education credits. So thanks again for joining us today. I am David Shapiro, and I am the Senior Manager of Programs and Partnerships for the Center for Health, Work, and Environment. Day to day, I run the HealthLinks program, which is putting on this webinar. I am a white male joining you from my home office in Denver, Colorado. I use he, him pronouns, and my Zoom background today is a black screen with our HealthLinks logo scattered throughout. I have brown curly hair and brown eyes, wear a beard, which is also brown and turning gray, more and more gray by the day. And today I'm wearing a light blue collared button-down shirt and gray glasses. So HealthLinks is the signature public health outreach program at the Center for Health, Work, and Environment. We are one of 10 centers of excellence for total worker health funded by the National Institute for Occupational Safety and Health, NIOSH, at the CDC. And we are located our offices are located on the University of Colorado Anschutz Medical Campus in Aurora, Colorado. We're going to pause and read our land acknowledgement this morning, which comes from the University of Colorado. As we gather together in this virtual space, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge the 48 contemporary tribal nations historically tied to the lands that comprise what is now called Colorado. Acknowledging that we live in the homelands of Indigenous peoples recognizes the original stewards of these lands and their legacies. With this land acknowledgement, we celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government and military service, arts, literature, engineering, and more. We also recognize the sophisticated and intricate knowledge systems Indigenous peoples have developed in relationship to their lands. We recognize and affirm the ties these nations have to their traditional homelands and the many Indigenous people who thrive in this place, alive and strong. We also acknowledge the painful history of ill treatment and forced removal that has had a profoundly negative impact on Native nations. We respect the many diverse Indigenous peoples still connected to this land. We honor them and thank the Indigenous ancestors of this place. The University of Colorado pledges to provide educational opportunities for Native students, faculty, and staff, and advance our mission to understand the history and contemporary lives of all Native peoples. So for our agenda today, we have a keynote presentation, which we'll be introducing in just a moment. We have a panel of speakers to provide some context to the keynote presentation, and then we will have a Q&A session for all of you to ask questions of the keynote presenter and our panelists towards the back end of the hour. As I mentioned, if you have any questions that come up during the presentation, your colleagues and peers that are on this webinar may have them as well. So put them in the Q&A box and we can vote them up, and we will make sure to prioritize those as we get to the Q&A section. We never have time for all the questions, but we hope that we'll address them. And if there's some themes, we'll try and gather those together and ask them of our participants. During this webinar, you see some of our potential objectives here: how to identify major causes of substance misuse and who's affected, how to communicate about substance misuse in your workplace with your colleagues and employees, and also how to build strategies to reduce the impact of substance misuse in your workplace. I want to mention also that today is International Overdose Awareness Day, August 31st each year, and September is Recovery Month as well. And so today kicks off a month-long campaign, and you may see in your LinkedIn feeds and other places on social media some posts like these ones that I've put up on screen here. Really what we want to do is talk about overdose and talk about substance misuse and how it impacts us. Overdose is everywhere, and today, August 31st, as I mentioned, is International Overdose Awareness Day. In the United States, overdose deaths increased by 30% between 2019 and 2020, with approximately 107,000 deaths in 2021 alone. And while it's not in their job description, ordinary community members like waiters, librarians, cab drivers, friends, and teachers are acting as frontline responders due to this crisis. There are solutions that prevent overdose deaths, such as providing naloxone kits, fentanyl testing, and opioid substitution treatment. So we talk about it. We hope to end the stigma and end the silence, and then understanding that prescription overdose and prescriptions do continue to be a leading cause. So they're using the hashtag #EndOverdose, and you can find more from SAMHSA and other partners about that. So it's my honor to introduce our keynote speaker today, Jennifer Place. Jennifer currently serves as the program manager for the Colorado Consortium for Prescription Drug Abuse Prevention and as an adjunct professor for the University of Colorado at Denver. Ms. Place is a licensed professional counselor and licensed addiction counselor who for nearly 20 years has been working with individuals suffering with substance use and other mental health disorders in employee assistance as well as treatment and prevention settings. Ms. Place is a board member of the Colorado Association of Addiction Professionals and previously served on the boards of the Colorado Employee Assistance Professionals Association and the Working Minds Advisory Board for the Carson J. Spencer Foundation for Workplace Suicide Prevention. So thank you, Jennifer, for joining us today.
Well, thank you very much, David. Thank you so much to your colleagues at the Center for Health, Work, and Environment for this opportunity. I am also speaking to you all from Colorado today. I identify as a white cisgender woman. I have many identities at the center of the power and privilege wheel, if you're familiar with that. For those who can't see me well, I am wearing a turquoise blouse and black sweater. I have my Lift the Label pin in acknowledgement of International Overdose Awareness Day. So thank you for also acknowledging that, David. This work and this day are very close to my heart. A sincere thank you to all of you as well for attending today. I realize this topic is generally something that folks shy away from. We wish we didn't have to deal with it in our workplaces. We wish we didn't have it in our communities and our families, yet here we are. As David mentioned, I've been doing this work for a while, really over 20 years. And throughout that time, as well as the decades before that, it was much the same. Employers and managers did not want to talk about this or learn about it. So I sincerely appreciate you all being here today and your interest in this topic and what we have to share with you. Next slide. As promised in our objectives today, I'd like to start today with discussing the causes of substance misuse, that age-old question of why. Why are people using X, Y, or Z? And the answer is age-old as well. We are human. As human beings, we itch to change our current state of being if we're stressed. I don't know if any of you have experienced that emotion as of late. We use if we're uncomfortable. And as humans, we are curious creatures. So we're always interested in new things and what it may do or be like with that experience. That lovely acronym of fear of missing out, that FOMO piece. Again, it's not new. This is part of our nature as human beings. I'm also guessing that many in our room today would agree that in the event that maybe you've used a substance, whether it be alcohol, look on your desk if there's caffeine anywhere, or even sugar, you've probably used for one of these reasons as well. Next slide. As for the ways we use substances, that does vary. As you see here, a little continuum. We've got experimental use, maybe something we try on occasion, maybe use a couple of times, we decide it's not for us, or maybe we determine that it's too risky to use again. Or there's social use. Typically, we call this recreational use, something that maybe become or maybe already is a part of one of the many cultures we belong to, our workplace culture, our family culture, our community culture, as well as others. Then we get into what we call problematic use. This is when our use starts to get in the way of our responsibilities. It may disrupt our routines. It may interrupt or cause some problems in relationships with folks in our lives. And then we have the smallest percentage of folks on the tail end who actually develop what we, as clinical folks, call a severe substance use disorder, something that which our normal nomenclature calls addiction. I like to put that in air quotes. And addiction is an issue in every US workforce. So that severe end of the spectrum does impact about 1 in every 11 workers in the United States. About 9% have been in 2020 research showed that 9% of individuals in the working age had a substance use disorder in the previous 12 months. Next slide, please. As for who are using substances, the answer to this question is all employees, for the most part. Again, it may be something that we don't consider to be problematic in the workplace, but the substances and the ways in which folks are using does vary. I don't want you to get caught up in some, I am going to talk about some trends. I caution you to get caught up in those trends too much because, again, I want you to think about all employees, most human beings, again, are interested in changing the way they are experiencing life in some form or fashion. As far as those in terms of some of those trends with who's using the most alcohol, marijuana, and illicit substances, young adults have historically had higher rates than use from older age brackets, so 26 and up in our workforce, which is consistent with decades of data. But ultimately, again, don't get caught up and just say, oh, we don't have a workplace of young adults, so this probably isn't an issue for us, because that's not the case. 25% of those over the age of 18 are using tobacco. 68% are using alcohol. 75% of those over the age of 18, again, our workforce, our working adults, are using illicit drugs, tobacco products, or alcohol. So any one of those three, again, there's overlap. Often folks are using more than one type of substance at a time. But even when we pull tobacco from that list, that percentage only goes down to 71%. So 71% of our working adults, and this is 2020 data, are using illicit substances and or alcohol. It is very likely that those percentages will go up a few points as we look at 2021 and 2022 data, because preliminary data collected throughout the pandemic has shown an increase in all types of substance use, unfortunately. And when we look at who is affected by substance use, the answer to that is also all of us. If we were all in a large auditorium together, I would ask, how many of you have been personally or professionally impacted by someone's substance use? And I guarantee that most everyone, I was maybe 1 or 2 hands that would not be up. And we would look around and say, wow, this impacts all of us. So we all need to be part of these discussions and learning more about what we can do in our workplaces and our communities. Because as employers, we're impacted, our colleagues are impacted, our family members and our friends, and certainly our communities have this ripple effect of who is impacted by substance use. So I caution any of you that might have had a subliminal message that says, oh, this isn't an issue here. Or you've had a supervisor or a CEO or an employee or a stakeholder in your community say, oh, that's not an issue here. I caution you, because our answer needs to be, it is. It's an issue everywhere, unfortunately, across our nation, which I'll get to some of those trends here in a minute as well. Next slide, please, David. As far as industry trends, construction, mining, and service or hospitality occupations have unfortunately had the highest rates of alcohol and other drug use disorders for the past couple of decades. There are up to 19% of the workforce in those particular industries that have individuals that are impacted by substance use in a problematic way. And again, just to caution those of you who said, oh, whew, I'm not in one of those industries. Just because you work at an accounting firm, don't get caught up again in that erroneous way of thinking that that's not an issue here. Because even in those industries with the lowest prevalence, such as education, healthcare, and professional and protective services, the lowest percent of all of those industries, again, at the bottom of our graph, is 5%. So 5% of that workforce, up to 19% of the workforce, depending on your industry and your organization. Next slide, please. And so while there is a lot of focus and discussion on marijuana, I'm from Colorado, it's been a large discussion here for a number of years, and illicit drug use increases. That's a lot of focus and attention in our media, in probably our boardrooms. The fact is that alcohol is still the most widely used and misused substance in the US. Slide, please. I know David mentioned International Overdose Awareness Day and overdose rates. It's important to point out to all of our workplaces that legal substances, such as alcohol, or in specifically alcohol, kills an estimated 95,000 people a year. It is the third leading preventable cause of death in the United States. And in 2015, 1 in deaths among working adults was alcohol related. So I don't want to leave alcohol outside of this conversation, even though often it is, for cultural and financial reasons, typically. The sad part of this 1 in 10 deaths is that the number of deaths we're hearing about now at work is increasing due to another reason as well. Next slide, please. As David mentioned, 107,000 Americans died in 2021 due to opioid overdoses. As you can see on this slide, it doesn't matter where you are in this country. I saw so many different states and places coming up in the introduction. So your geography doesn't matter at the end of the day. The rates of overdose deaths is increasing everywhere, mostly due to an illicit form of a powerful opioid called fentanyl, if you've heard of that, or one of its many derivatives, such as carfentanil. It's contaminating other substances that individuals are using recreationally, or they're using habitually or consistently. Many of these individuals who are dying are also our working age adults and colleagues. There are the family members of our employees, and they're individuals who are using recreationally, as when we looked at our spectrum of kind of the different types of use. Historically, in my field, in my work, we have talked about individuals who have a substance use disorder or an addiction, and that's where a lot of our focus has been in terms of workplace interventions. But we need to know that a lot of the individuals who are suffering and dying from recreational use don't necessarily fall into that category that we once would have kind of looked at and tried to focus some attention on. Next slide, please. I'm going to expect that all of you are familiar with these costs. Just want to remind you that this $100 billion figure is just the share of costs experienced by the workplace in the US. The total tab for this is estimated to be well over 400 billion. Yes, that's with a B, in the US alone. Something you may not be aware of, though, is that binge drinking, so drinking more than 3 drinks per sitting for someone who is a cisgender woman, or drinking more than 4 for a cisgender male in one sitting, that's binge drinking, and it's responsible for over 70% of the workplace-related costs. So again, it's not necessarily individuals with a use disorder or an addiction per se, but individuals drinking more recreationally, but in a heavy way. If you're interested in potential costs for your workplace based on the size of your organization, the age demographics, the industry that you're in, there's a cost calculator that I'm going to put the link to in, I'll have someone put the link in the chat so that way you can take a look at that when this webinar is over, and you can take a look at, plug in some of those factors, and it'll do an estimation of what the costs your workplace may be experiencing due to substance use. And I don't share these costs with you. I don't want you to be afraid of it. That's not the intent. What I want you to do is embrace it and understand it. Next slide, please, David. Because we've been told for far too long that we have to run from this. We have to be afraid of it. We have to get this out of our workplace. I can tell you all that the 20 years I've been doing this work and the decades of my colleagues doing this work before me, it hasn't worked. We cannot fire our way out of this. We cannot get rid of employees who have some sort of issue that we suspect or we may know about. We need to embrace our employees who are struggling. We need to address our workplace culture that perpetuates the reasons for using, such as stress, overworked, lack of flexibility. We need to address our cultural components that perpetuate substance use. Maybe we shouldn't have an open bar on Fridays in the boardroom. Maybe we should create other opportunities for our employees to get together and de-stress, such as bringing in yoga instructors or providing gym memberships and encouraging employees to be part of other types of healthy, pro-social, non-substance related activities as a way to get together. Next slide, please, David. I want to shift your thinking a little bit because, again, we cannot fire our way out of this. It has not worked. It is not going to work. Workers in recovery, individuals who have had a substance use disorder in the past and have found a way on a path of recovery, they're some of the biggest assets to our work environment. And they miss the fewest days of any group, even the general workforce. So in terms of absenteeism, presenteeism, those are not issues for individuals who identify as in recovery. They're some of the most loyal employees you can hire. And so that is an untapped workforce. And often this slice of our workforce or potential workforce is discriminated against because many individuals with a history of substance use disorder may have a legal consequence or some sort of conviction in their history. Not all states have a ban the box component of their employment law. So many states, you have to check if you've had an arrest or a conviction on your job application. And often, if individuals have checked that box, they're discriminated against, they're tossed aside and not given employment opportunities. However, it's important that we know that, again, individuals who have found their way on a path of recovery are going to be a strong component and advocate and loyal employee for us and help our bottom line. There's a growing body of international evidence, and not just in the US, that around initiatives that promote prevention and early intervention in our workplaces provides positive returns on investment for an organization. So something to consider. Next slide, please. And so while I grew up professionally in employee assistance work, I do heavily endorse them and the benefits that they bring to your organization when you use them. Many individuals or many organizations, they have an EAP, but they don't know how to use them. So you'll hear more about how the benefits of that here in a little bit. But other efforts that can have a positive impact on your workplace culture are groups such as employee resource groups, if you have the opportunity to create some of those in your workplace. And depending on the size of your organization, there are actually recovery groups that have formed in organizations. If you're familiar with Salesforce, they have one of the most prominent examples of this. They have a sober force community. So a group of individuals in recovery who get together virtually, because many of them are scattered throughout the world. They get together virtually and they have a beautiful community of recovery support right there in their workplace. Next slide, please. I also encourage you all to find out if your state has a recovery-friendly, or it may be called a recovery-ready workplace initiative. I am so proud that we are launching one here in Colorado. Our agency's been involved with that, as well as in partnership with the Center for Health, Work, and Environment. And I'm pleased that you're going to be hearing from one of its key contributors in just a moment. So with that, I again thank you so much for your presence here today. I encourage all of you to embrace your innovative and solution-focused spirit. Again, remember the definition of insanity: doing the same thing and expecting to get different results. So please take what we've discussed here today, what you're going to hear today, take it back to your organizations and refocus on how you're creating cultures of connection in your workplace. Because at the end of the day, the opposite of addiction is connection. Thank you so much.
Thank you so much, Jennifer. As a reminder, if you have specific questions for Jennifer and our upcoming panelists, please put them in the Q&A. If someone has asked the same question that you're thinking about typing, use the thumbs up to move it up the ladder, and we'll get to as many questions as we can after our next round of speakers. So it's my pleasure again to introduce our next speaker, Dr. John Narine. John is a person in recovery, a certified employee assistance professional, and he received his doctorate in business administration by completing a qualitative research study on leadership strategies to prevent substance abuse relapse and optimize business viability. He's also the author of Leading Workplace Addiction, which is based on his own research, and founder of Recovery Friendly Leader, a nonprofit organization whose mission is to empower business leaders on solution-based strategies that help them provide support and practical guidance for their employees impacted by addiction to keep the workplace safe, healthy, and productive. As an employee who has struggled himself with addiction, John understands and relates to others who live in fear of being judged or fired while trying to keep up demand. John is a passionate recovery advocate who is wholeheartedly committed to the success of recovery-friendly workplaces. So thanks, John, for joining us here today and being willing to share your story.
Thank you, David, for that introduction, and thank you, everyone, for having me here today. As David mentioned, my name is John, and I've struggled with addiction most of my life. You know, Jennifer mentioned some of the reasons why someone may choose to use is to change how they feel. And for me, that was very true. Feeling like I don't belong, or I don't fit in, or just believing that I'm not worthy. Those things ran my life for so long. And for me, the quickest solution was to escape them and to run away from them by using with drugs and alcohol. You know, that introduction that David gave about me working on this recovery-friendly workplace toolkit, becoming an author of a book, and finding a nonprofit, you know, these are all I consider opportunities and gifts that I've been given as a result of changing my life today and becoming a healthy, productive, and active member of society. So today, I'm going to share with you my experience with two different employers that I've had. Now, both of these stories end with me being terminated. However, I do believe one of them is truly a success story. See, years ago, at one of my previous employers, I was really close with my managers and the owners of the company. I did the best job I could to impress them. I loved going above and beyond. My job description, I would work long hours with no complaints. I took on additional duties that they asked of me, and it made me really happy because it made the owners happy. And I'm not going to lie, there were some special perks by being close to the owners. I got special treatment that other employees didn't receive, and that also made me feel good about myself. And I love to celebrate with them, going to happy hour or taking the client out for drinks. And of course, the company paid for it. But over time, I was unable to sustain that life. It became noticeable that the results of my drinking were becoming more consequential than other people. You know, I would start to call in sick more often. I was late to work or to meetings. But as this happened, I would always be given a pass by either the manager or the owners of the company because of the amount of work I was always willing to do. And that cycle would just continue. I would go out with them on Friday for happy hour. Everyone would go home, but not me. I would continue. I would call off on work on Monday. I would be late on Tuesday and ready to go again by Friday. And over time, I wasn't as productive or reliable as I used to be. But I was allowed to get away with it for so long that I felt entitled to get away with anything, honestly, at this company. And I will say that the company really didn't have the culture nor this training that was supportive to employees in recovery, nor was I ready to admit that I had a problem or seek out any help. So the first time that my manager tried to address his concerns about my behavior and get some answers as to why wasn't I showing up or working like I used to, I didn't like it and I quit my job right on the spot. But it was after separating for this company that it finally started to sink in that maybe I do have a problem and maybe I should seek out some help. So I did. Over the years, I went to many rehabs and support meetings to try and figure out what was my path to recovery. And as I kept trying to find this path, I moved to Denver here in Colorado. I got a job and things were really going great. I was doing really well at this new job and I really liked the position I had. I loved the people that I was working with, including my boss. But eventually life happens and it happened to me again. And I slipped and returned to use. So I ended up calling off on Monday, sick, just like I used to, and went to work Tuesday, just like I used to. But this time, I just really struggled at thinking about having to live another lie again. This wasn't the reason why I was trying to get sober anymore. This wasn't the reason why I moved. So I waited for my boss to come in and I went to her office and I told her that the reason I didn't come in is not because I was sick, but because I have an addiction and I relapsed. To my surprise, she was very, very understanding. And that was what I needed to feel in that moment. Understood. Feeling like I don't fit in, I belong, I'm wrong for who I am. Someone that understood who I was and was willing to help me was something brand new to my life, especially in a vulnerable moment. This company had a culture that was people first. And for the first time, I was admitting I had a problem. For the first time, they were willing to support me. And I was receiving that support. I was offered flex time to go to meetings or days off if I needed them, FMLA to go to rehab. And I did continue to struggle. So I also started to experience some consequences at work. For my poor performance, I was presented with a written warning, and then another warning, and then a final. And it was decided after that final warning that the best thing for my recovery and the best thing for this company was to separate. And the reason this is a success story is because I needed to finally put my recovery first above everything else. And for me, I was unable to do that and work at the same time. So by separating me, by having some communication and a conversation and a plan for what that separation was going to look like, well, the company was able to prevent any further costly disruptions. And I was able to finally find a path to recovery. Even though this company did have the culture, the core values, and the accommodation supportive to employees in recovery, much of how it was supported was through some trial and error. What they lacked was the training and education for how to support employees impacted by addiction. For example, during one of the periods where I've been struggling, HR called me and suggested that I use the company's employee assistance program. They said I would receive free counseling and it would really help. So I thanked them and quickly hung up the phone. And I did not use them at all because I did not know what the EAP would relay back to my employer. HR didn't tell me in that conversation that it was confidential. I didn't ask HR because I was afraid what they might wonder why I was asking. And I didn't remember that I could look it up myself. So for those reasons, I really lost out on one of the most valuable services that would have really helped with my recovery. Getting sober is by far the hardest thing I have ever done in my life and still is today. But how I did that was by surrounding myself with people that helped me realize I needed to make recovery my number one priority if I ever wanted to have a life to live or a job that I could keep. You know, I'm not saying all employees need to follow my path and quit their jobs today. By no means. We all have our own unique path to recovery. But what I am saying is we cannot do it alone. And for me, that was very hard to admit. You know, I needed that strong leadership in my life, all parts of my life, including at work. So that's why this work, why we're meeting here today, you know, how we help employees find recovery is so important. And it's very, very dear to my heart. So thank you all for allowing me to share my experience with you. And my hope is that at least one employee can realize that they're not alone and that they're worth getting the help that they need to live a meaningful and purposeful life. Thank you.
Thanks, John. Thank you so much for sharing your story, for your honesty and your vulnerability, and for acknowledging and bringing to light how important it is to make this visible, right? Talking about it, making a connection is just so important. Once again, a reminder to our audience, if you have questions for Jennifer, John, and our upcoming speaker, please put them in the Q&A and we will get to those shortly. So I'm also pleased to introduce another speaker on our webinar today, Dr. Danny Kimlinger. Danny is the Chief Executive Officer of Minds & Associates. She has a background in human resources and organizational psychology and leadership. She's also highly involved in the community volunteering, where she sits on numerous nonprofit and professional boards. In 2021, Danny was recognized as a Titan 100 CEO in Colorado. She has her undergraduate degree in psychology and sociology and a master's of health administration. She completed her PhD in the School of Business Psychology and Organizational Leadership at the Chicago School of Professional Psychology. Danny's passionate about people, reading, running, animals, weightlifting, and the outdoors, engaging in backpacking, hiking, snowboarding, trail running, and camping. So thank you, Danny, for joining us today and providing the perspective from an EAP.
Thank you so much for having me today. Hello, everyone. My name is Danny. I'm a white cisgender female joining from my home office in Lakewood, Colorado. My pronouns are she, her, and I have blonde hair, green eyes, and I'm wearing a green shirt today. Minds is an international business psychology firm. We provide services across the country and are now serving clients internationally. We provide employee assistance programs, managed behavioral health care, critical incident support, police health, and organizational psychology services. We have a PPO network and staff behavioral health therapists in clinics across the country. We are seeing substance misuse in all of our services, everywhere. We have all been hearing about mental health, especially around the pandemic. So why is that? Why are we hearing about this? Well, a recent APA, American Psychological Association population survey illustrated that 70% of the population are experiencing at least one mental health symptom. 70%. And with that, if you are not part of that 70%, very likely your loved ones, your colleagues, those around you are. I'm going to go ahead and share some of what we're seeing in our employee assistance programs. In terms of data, we did ask some of our team to put together some data for us so that we can share. And before I do that, I'll make sure, I know that many of you know what employee assistance program is, but I'm just going to high level overview it. An EAP, which is what I'll refer to an employee assistance program moving forward, is offers services that are at no cost to the individual accessing the services. So these services often include counseling, legal, financial, online, and management services. They may also include other services such as mindfulness, online training, development, coaching, peer programs, and wellness services. Here's what's true. Most organizations have them, and we still run into a number of organizations that don't know that they have one. So that's important to know. Even if you're not paying for a standalone employee assistance program, you may have one embedded in your health plan, your short-term or long-term disability program. So why are these so important? Well, the biggest reason, our biggest advocacy point, is that the barrier to entry is so low. That is, that therapy doesn't cost the employee a thing. You heard Dr. Narayan sharing that, he was told you get free therapy sessions through the EAP. That's right. With the way that, high deductibles look and how expensive therapy can be, it's really nice to have a service that doesn't cost those employees or their household members anything at all. Also, nearly all EAPs have other services that can be supportive. So, you know, whether someone's looking to decrease their substance use or to get into recovery altogether, services such as work-life services can be really helpful in finding sober living activities. Wellness coaching services can also be really helpful. They can help with goal setting, finding more healthy activities. You know, if somebody wants to get into, I'm a runner, so I'll use that, training for their first marathon, they can have a coach support them around those. So going back to the data and what we're seeing, Jennifer did a really nice job of talking about the industries and the breakdowns that she found in her research. And what was interesting to us is that our data mirrored that pretty closely. So construction and labor had the highest utilization of EAP for substance use. I want to also point out that this is historically the lowest utilizing industry that we see. And since COVID, we've seen it increase, which is really, really great because it's important that people are accessing those services. The service industry came right in below in terms of our data, with other industries following. I wanted to share some other demographic information because I thought it was pretty interesting. So our annual data showed gender breakdowns as following. So 31% of people who accessed our EAP services identified as female, and 67.9% identified as male, with 1.1% identifying as a different gender outside of male-female. The age of the clients seeking services for substance misuse spanned consistently. In our book of business, as we were looking at our data, there was a slight uptick of clients that were born in the 1980s. And geographically, we are not seeing a significant difference per capita with regards to where our clients are around the country. So EAPs are also great tools for leaders in HR too. So there's a variety of different tools and resources that are available that can be helpful. So work performance referral programs, as we call them, but most EAPs have them, are supportive referral processes where if you have an employee that has a hot UA or comes to work impaired, but you want to keep them and help them potentially get support, get into recovery, there's a program that can be very helpful. And this is a program that is fairly confidential. There's a limited release, and the employee is asked to sign that. And what the release does is it allows for HR and or the referring manager to just receive information that they are complying. So no detail at all about what's in the therapy sessions. And there's a case manager typically that's assigned. That case manager is kind of acts as the liaison for the client, for the therapist, and for the HR contact. So that can be an incredibly supportive process that can help people get right on track. I did ask our case management team what they're seeing in our work performance referral cases, and still the highest that we're seeing is THC that is found in random UAs. Not to say that we aren't still seeing that you know, people are being referred, they're coming to work impaired, but it's primarily THC in their UAs. Another service that I think is often missed or sometimes can just be easily overlooked is reporting. Most all EAPs are going to offer reporting to organizations, and this can be so valuable to you in your wellness initiatives and your proactivity in your organization. So if you get your report and you see in the last year that 15% of your population seeked the EAP services for drinking, maybe there's something you can do and build in your wellness program, or look at trainings and help people be aware of the detrimental effects that alcohol can have on one's body. So there's a lot of really important pieces that can be brought in for that reporting. So one piece that I will just, you know, kind of elephant in the room, I suppose, is that, you know, the EAP is often sort of, it can be a negative spin on it, can be that nobody ever uses the EAP and it's not useful. Like, you know, nobody even knows it's there. Well, with an EAP, whether it's embedded in a program or it's a standalone program that you're paying for, the program wins if both the organization and the program boost utilization and awareness. So nobody knows better than you and your organization what works. So how do you get information to your employees? How can you drive communication? You have an intranet that people have to go to for their payroll information or their benefits or any of their communications from the organization. Probably a really good place to highlight the EAP. Social media, if you have employees that you're aware of that are active on your social media, see what you can do to push out content there, and have your EAP partner help with that. Have them help with campaigns. If you have wellness initiatives that you can plug the EAP into, build into those. Work with what works. That's what we recommend. And even bite-sized reminders along the way, because let's face it, when we do open enrollment and we're alongside all the other benefits, it's hard for everyone to remember everything that's available to them. So if you can keep those bite-sized reminders of different services that are available, highlighting days like today, that can really keep the service in front of them. The last big piece that I want to highlight, I think is so important, and I'm so thankful that Dr. Narayan mentioned it, and that was around confidentiality. So no doubt it is a common concern about confidentiality in the Employee Assistance Program. I think it is incredibly important to make sure that your employees are aware that EAPs are bound by federal laws around confidentiality. We cannot share with the organization if you're using the service, or if your employees are using the service, or even if they called in. And we do get requests sometimes for information about whether someone did call in. And it's an innocent thing. Maybe HR will contact us and say, I referred Danny to the EAP. She's having a hard time. I just want to make sure she connected. We can't tell them. We can't say whether or not they connected. So the only two kind of exclusions, I suppose, to confidentiality to the workplace are, a release from the employee, which we talked about with the work performance referral type of program as an example, with the employees very aware of what can be shared based on that release, and they have to consent to that. And then reporting. But once again, the reporting is aggregate and is not going to identify what people are going to the Employee Assistance Program for and why. And if there's a small population of folks that are in the organization, EAPs are very mindful about whether or not they can even share a report. So I will conclude here. Thank you so much for your time and for allowing me to be here today. And remember, as Jen said, and I loved it, I'm going to remember it forever, the opposite of addiction is connection. Thank you for your time.
Thank you, Danny. So we've had some questions. Thank you, everyone, for participating and putting questions in the Q&A. And I want to honor that we have 10 minutes or so now to address some of these questions. I think the first one that's most relevant, and Jen, I think I'll ask you of it first, is if there's someone who is looking for information for a recovery support program right now, what do we recommend? Where do we recommend they go? I know we often recommend NAMI or SAMHSA. We're going to share the toolkit as a resource, but I want to make sure I address this in the room. If there's people that are looking for a recovery support program, what next step would you recommend they take?
Well, as Danny illustrated, you can call the EAP if you have one. They should have a comprehensive list of recovery support services in your area, because some of this will vary depending on your geography, where you are. There are a lot of online resources now which were not available 2 years ago. So if there's a silver lining to some of COVID in terms of substance use and recovery, absolutely online support is incredibly available now, whereas it did not used to be. There's an agency called the Recovery Advocacy Project that has different state chapters. It's not in every state though. The Recovery Advocacy Project, Google it, see if you have a state chapter, because they should have a list specific for your state on different recovery, not just peer-led sober support groups like AA or NA or Al-Anon, those kinds of groups, but they have recovery community organizations. These are organizations that form by and for folks in recovery or pursuing some sort of recovery journey. And recovery community organizations do a lot of work, but they are regional and usually specific to one location, so less available virtually, although there are some exceptions. So check out the Recovery Advocacy Project to see if there is a list for you in your state. And those are a couple of suggestions I'll throw out there right off the bat.
Thanks. John, any suggestions from your standpoint? If there's someone on this webinar that's saying, hey, I need some support, I need some help, what would you recommend other than the EAP or anything that Jennifer has just mentioned?
If they're going to their manager and asking those questions, or if they just need help in general?
I think let's address if people just need help in general first. We can go to managers and employer-specific support, but I want to make sure we cover this. And if there is anyone joining us, we have over 400 people here that are assuming or thinking that maybe they could use a recovery support program, today or this week, that we address that.
Right. I have a website, and there is a page called Recovery Support. I forgot what my page is called, but it's a whole list of resources supportive to recovery. That's the name of the page. And it just lists a bunch of local here in Colorado, but really you can find them, and national actually, resources for groups such as what Jennifer mentioned, AA, NA, and there's actually, I think, dozens of types of A groups for any specific malady or challenge that you're having in your life. There's also non-spiritual based groups that are really based on science. And I even have a resource on there that lists many other types of support groups. For me, I didn't know which one was going to help. So I really just reached out and tried. I sat in on different types of meetings and just listened. Did anything relate to me? Did I experience anything similar? And if I thought I did, I would go back and maybe go back to a different one. And I just kept doing that until I found my seat somewhere.
Thanks, John. I want to shift over to another question that's come up, which gets at what John was saying, which is manager support, how to talk to a manager. Danny, I'm going to ask you about this question that's come up in chat about this culture we have in the workplace sometimes where leaders aren't as sensitive as they could be around some of these issues, and what sort of advice or communication tips do you have for managers, leaders in their situation of how to handle someone in recovery? I know a recommendation to the EAP is always valid, but what do you do in the conversation when someone comes to you and says, I'm not comfortable with the language we're using around this, or I feel like I have an issue? What suggestions do you have for managers, supervisors around that?
So one of the most powerful promotions, as we've found in the EAP world, which I think applies to your question, David, is when a personal experience or a personal success is shared. And so obviously we would never want to push managers or leaders to say that, but I'm just saying that for anyone in the room that either may themselves have experience or a family member. I think just, having that as part of the conversation can be helpful. Of course, you don't want to detract from the employee's experience. I think language is really important. So being mindful about how you talk about substance use in the workplace, like, just an example that I actually experienced in an organization in the last year was somebody had made a comment like, well, gosh, that email, I wonder if she was like drunk or something when she wrote that. Those kinds of comments. So being really mindful about the language and how you're talking about mental health and substance use. It can be really, I think that's important. Being open, supportive, checking back in on the person, not diagnosing. I don't care if you're a psychologist and you own an organization, that do not diagnose your employees and do not. So I think those are a couple of the pieces I would offer.
Yeah, thanks, Danny. It really reminds me a lot of the conversations we're having around behavioral health or mental health in general. It is not anyone's job in the workplace to treat or diagnose. You're there to support what John said is so important, which is human connection, right? We're all people. We're all experiencing stress in different ways. We're all finding coping strategies in different ways. And really our goal as humans and people on this planet, I feel like, is to foster connection where possible. And so if someone is reaching out, if someone is mentioning that they're have an addiction or struggling or they're in recovery, that's an opportunity to connect with someone, an opportunity to build more of a relationship and a connection. And I think that's what we should focus on first. Couple other questions that have come up. There was a question about medical or cannabis use in the workplace. I'm going to table that particular question from a student in Colorado State University because I'll mention that we're planning in August of 2023 to have a webinar specifically on cannabis in the workplace. The biggest takeaway we've had from some of the researchers in the field here for organizations is know why and how and when you're testing, especially in Colorado, and why you're using that benchmark as a testing, right? So testing is really a big piece of this. If you're going to test for cannabis, why are you doing it and what are the ramifications going to be in a state like Colorado where it is legal? Also, I just wanted to ask about, Jen, you mentioned some of the industries that have highest use and substance misuse, like construction, mining. Danny, you mentioned that men are often calling the EAP. I don't know if there's a tie in there, but talk to us a little bit, Jennifer, about some of the industry trends and why we would see certain types of groups of people more prone to substance misuse than others, perhaps.
That's a loaded question, David. I'll try and give some overview on that. But traditionally, as I mentioned earlier, we see more substance use happening in younger adults. So again, they may be more in that experimentation stage, maybe more in that social use, less bound by family obligations. So they're going out in the evenings, they're doing these things. As well as we see higher substance use disorder. So when this becomes problematic for our male identifying employees or individuals over the age of 18, I'm thrilled at your stats, Danny, around more individuals in construction. Again, these male identifying dominated industries, which historically have had less utilization of help-seeking behavior, that those numbers are going up. That is huge. So folks in those industries are doing some good work around, it's okay to ask for help. You're suffering from this too, because we do know that individuals identifying as male in that workforce age, I think 25 to 44 have the highest rates of suicide nationally. And so that's most at risk. So I love that those are going up. But we do see more individuals who are experimenting and using substances who have experienced and are still experiencing systemic oppression. They're experiencing health inequities, have had less access to health care resources and other types of services. So it's important that we know that if we have a workforce that is diverse and we have individuals who've been marginalized in one way or another, we need to be addressing if that marginalization is being perpetuated or still happening in our culture, in our company. We need to be looking for that. We need to be providing resources such as EAP and stressing folks to utilize those resources, especially if they're in those at-risk categories. So I don't know if that addresses all the components of your question, David, but I hope I gave a little bit of a high-level view of that.
Well, I agree. It was a loaded question with a lot to it, and I appreciate your eloquent and concise response. So thank you, Jennifer. And thanks, John and Danny, also for joining us at our webinar. We're just coming to the close of the hour. All these webinars, always the hour goes by so quickly. It's been such a fruitful and important discussion. And on International Overdose Awareness Day, bringing this topic to light is really important to us at the center. Remember that as you close out of today's webinar, and we will leave the link open for a while for all of you, that there should be a survey that comes up for you to fill out. One, we appreciate the feedback, but two, if you are trying to claim continuing education and CHES credits, which we know are so important to so many of you on this webinar, please fill out that survey. We'll also put a link to the survey in the chat in case for some reason your browser doesn't automatically have it pop up. We do have our sixth and final webinar of 2022 coming up next month. On Wednesday, September 21st, we're going to be talking about the built environment and getting outside. We know the value of getting outdoors for our mental health, and so this is what we're going to talk about, is how the physical workspace, both at home and at the office, contributes to our overall health and well-being, as well as the importance of getting outdoors at work, and what are some of the things that people who work outside should be considering for their own health and well-being. Once again, want to thank our partnership with the Colorado Consortium for Prescription Drug Abuse Prevention, as well as Jennifer Place, Dr. John Narine, and Dr. Danny Kimlinger for joining us today. Thanks so much for an important discussion, and best of luck to all of you. Hopefully you'll see in our follow-up the resources that we talked about today, as well as the presentation, and the recording will be available as well. So thanks again, everyone, for joining us.